All right, today we're diving into a really interesting medication for type 2 diabetes called sitagliptin. What makes it so interesting is that it works in this uniquely smart way, kind of partnering with your body. We're going to break down exactly how it does that. Okay, let's get into it. So let's just start with a big question, a big what if. What if a diabetes pill didn't just force your blood sugar down, but instead it helped your body's own natural system just work better? That's really the core idea we're going to explore today. Okay, so first things first, what exactly is this stuff? Well, sitagliptin, which you probably know by its brand name Januvia, is an oral medication you take as a pill. It's specifically for managing type 2 diabetes. And I want to be clear, it's not for type 1. Its real power comes from the specific class of drug it belongs to. Sitagliptin is what's called a DPP-4 inhibitor. Now, I know that sounds super technical, but don't worry, just hang with me. This is the key to understanding everything. The simplest way to think about it is that this drug is designed to protect your body's own little helpers, letting them do their job for longer. And we're about to meet those helpers right now. To really appreciate the solution, we first have to understand the problem it's solving. So let's take a look at the body's natural, but often struggling process for dealing with sugar. So, in a perfect world, here's how it's supposed to work. You eat something, right? And immediately, your gut releases these amazing little helper hormones called incretins. They're like messengers. They shoot over to the pancreas and say, hey, release some insulin to handle the sugar from the meal. At the very same time, they tell the liver, whoa, hold up, stop making extra sugar for a bit. It's a brilliant system, but of course, there's a villain in our story. And here it is. Meet DPP-4. This is an enzyme that's just floating around in your body, and its main job is to break down those helpful incretins. The problem is, it's way too good at its job. It's like an overzealous paper shredder that destroys the release insulin memo almost as soon as it's printed. This means the helpful response gets cut short way too soon. So if DPP-4 is our paper-shredding villain, then sitagliptin is the hero of our story. It was designed with one very specific target in mind, stopping that paper shredder from working overtime. And that's its whole mission, plain and simple. It's a DPP-4 inhibitor. It finds that enzyme and blocks it, basically stopping it from destroying those incretin helpers. It's like putting a guard in front of the paper shredder, making sure those important messages can actually get through and do their job. Okay, this slide right here really shows you the payoff. It's the aha moment. On the left, in the before scenario, you see the problem. DPP-4 is just shredding those incretin helpers. The result? Less insulin and more sugar from the liver. But look to the right. With sitagliptin, the drug acts like a shield. The incretins survive way longer, which means they can boost insulin release and tell the liver to chill out on making extra sugar. It's a night and day difference. But here is the absolute key, the thing that makes this so smart. The whole process is glucose dependent. What does that mean? It means the drug only enhances your body's natural system, which is already designed to kick in when blood sugar is high. So when your sugar levels go back to normal, the effect just backs off. This is huge because it dramatically lowers the risk of causing hypoglycemia, dangerously low blood sugar, which can be a real problem with some other diabetes meds. Okay, so we've got the science down. We know how it works in theory. Now let's talk about what this looks like in practice for actual patients day to day. The standard dose is about as simple as it gets. It's a 100 milligram pill, and you just take it once a day. And what's really convenient is you can take it with or without food, which honestly just makes it so much easier for people to stick with it. And sitagliptin is pretty versatile. It's a real team player. Sometimes it's prescribed as monotherapy, meaning you take it all by itself. But way more often, it's part of a team, used in combination with other common diabetes drugs like metformin to get even better blood sugar control. They even make single pills that combine it with other drugs to make things even simpler. Now, this next part is really, really important from a safety standpoint. Your body gets rid of sitagliptin mainly through your kidneys. Because of that, the dose has to be adjusted based on how well a person's kidneys are working. So for someone with moderate kidney problems, the dose gets cut in half to 50 milligrams. And for severe issues, it goes all the way down to just 25 milligrams a day. This is a critical detail. Of course, like pretty much any medication out there, it's not without potential risks. So let's talk about the side effects you need to be aware of. The good news is the most common side effects are generally pretty mild. We're talking things like a stuffy or runny nose, a sore throat, basically common cold symptoms. Headaches can happen too, and some people might get a little bit of an upset stomach, but for the vast majority of people, it's tolerated really well. But it is absolutely crucial to know about the serious, though thankfully very rare, side effects. These include things like acute pancreatitis, which causes this severe, constant stomach pain, or disabling joint pain, and serious allergic reactions. If any of these symptoms pop up, it is vital to get medical help right away. So, with all of that in mind, let's step back for a second and put it all together. Let's weigh the advantages against the disadvantages of using sitagliptin. On the pros side, the big headliner is that very low risk of low blood sugar, which is a massive plus. It's also weight neutral, which is great because some other diabetes drugs can cause weight gain. And of course, that simple once-a-day pill and the fact that most people handle it well make it a really popular choice. Now, for the flip side, its power to lower blood sugar is a bit more modest when you compare it to some of the newer drugs on the market. And unlike some of those newer options, it hasn't been shown to reduce the risk of major heart problems. It can also be more expensive than older generics, and we always have to keep that risk of those rare but serious side effects in mind. And that brings us to our final thought for today. Sitagliptin really represents a shift in strategy, from just forcing a change in the body to intelligently boosting the systems that are already there. It really makes you wonder, right? Is this kind of smarter, more cooperative partnership with our own biology? Is that the real future of how we manage chronic conditions like diabetes? It's definitely something to think about. Thanks for tuning in.